They said now we are coming into the oral cavity. So first see here, okay. They said this is the oral cavity, okay. A part of this tongue is not is missing. We don't know why. Anyway, so this part is basically part of the mandible. Okay, this portion is basically the part of the mandible. And if you go below the mandible, here is a bony structure. This is the hyoid. Very good. Below the hyoid, this one is thyroid cartilage, and so behind the thyroid this is the larynx, and behind the larynx what is this? Yes sir, this is the cricoid cartilage. This is the cricoid cartilage. Okay, so cricoid cartilage, thyroid cartilage, hyoid bone, and here is your mandible. Sir, what is this structure? It is a epiglottis. Now, yes sir, if we are talking about this, then if we have the tongue here, and the epiglottis here, so there is a gap that is present between the tongue and the epiglottis, right? This particular gap. Sir, what do you call this gap? So this is called as the vallecula. This is referred to as the vallecula. V-A-L-L-E-C-U-L-A. The vallecula. So the vallecula is present between the epiglottis posteriorly and the tongue anteriorly. Basically, the tongue is connected to the epiglottis by three folds, a pair of lateral and one median glossoepiglottic fold. Okay, that is present. It is very well visible in case of a composite viscera, not quite understandable here. Anyway, जैसे ताले, this is the region of the vallecula and this is the region of this is the epiglottis. So behind the epiglottis, this is extending into the larynx. So epiglottis has a surface that is towards the oral cavity and another surface towards the nasal cavity, that is the laryngeal cavity, right? So if it is going towards the laryngeal cavity, what should it be lined with? Pseudostratified, ciliated columnar. Very good. And what will be this lining that is towards the oral cavity? Yes sir, it is non-keratinized, stratified, squamous epithelium. Clear? Done. Understood sir? So this is basically the region of my oropharynx extending from the soft palate to the epiglottis. Now if you come here, just say this is the tongue. We are just pulling the tongue a bit and you can very well observe two things. Number one is here we are getting the gloss. This one is my palate. Sorry. Just say this is the palatoglossal fold. Can you see the palatoglossal fold? Right? Just say this is the palatoglossal fold. Could you see the palatoglossal fold? Right? Now, if you pull the tongue here, that means a bit. Can you see another fold that is coming from the glossus? From the palate to the pharynx. It is going downwards. Can you understand? Anybody has a gloves? Okay. So see, this is your palatoglossal fold and this is your palatopharyngeal fold. Here is a gap between palatoglossal anteriorly and the palatopharyngeus posteriorly, and the floor is formed by the posterior third of the tongue. So this particular triangular region is the tonsillar fossa. So what is present here is the palatine tonsil. Clear? Tale sir, palatopharyngeal fold, palatoglossal fold, floor formed by posterior third of the tongue. Here is your palatine tonsil inside the triangular tonsillar fossa. So there are how many tonsils are there? Say two palatine tonsils, right and the left. Right and the left. Right, the floor is by the posterior third of the tongue, where we get the lingual tonsil. We have already talked about the nasopharyngeal tonsil and the tubal tonsil. You take all this, you get what is known as the voice string. Okay, now if you are talking about a bit about this portion, so here, just said we have gone this. Now if you go to the anterior aspect, just said we had seen hyoid bone here, this one mandible here, but we really could not understand the muscles except for one. Just said this particular muscle is the hyoglossus muscle. This fan shaped muscle is the hyoglossus muscle. So here also you are going to get the hyoglossus muscle, but here you also find one muscle that is actually going to the tip of the tongue, right sir? So this particular muscle which is going to the tip of the tongue is called as the genio, because it comes from the superior genial tubercle and it goes to the tongue. So this is called as the genioglossus. This is referred to as the genioglossus. Now from here, if you go downwards to the hyoid bone, what would you get? Yes, that goes from the inferior genial tubercle to the hyoid. So here is your mandible and here is your hyoid. So this particular muscle is the geniohyoid muscle. Okay, this is the geniohyoid muscle. So geniohyoid basically remains in the center. Okay, and on the sides of it, on either side lies the mylohyoid. Both of them are attached to the mandible as well as to the hyoid, but geniohyoid is in the center, coming from the mandible, that is, it is coming from the inferior genial tubercles of the mandible, whereas mylohyoid muscle comes from the mylohyoid line, which is at the periphery. Correct? So we have like two lines and two dots. So through the two dots you draw two lines, that is the geniohyoid, and from the lines you draw the mylohyoid line, and then join them all together at the hyoid, you get the entire oral diaphragm. Okay, so this is the portion that we were talking about. So this is end of it.